Cancer is considered one of the most serious human diseases. If no action is taken, the disease progresses rapidly and leads to irreversible consequences. However, with early diagnosis and timely treatment, the prospects for maintaining health are not so bad. It is important to know which symptoms may indicate the disease. While they are not specific, when several are combined, it's worth consulting a doctor. Signs of cancer vary, and one of them is a specific odor emanating from a cancer patient. Watch the video to the end to learn about the earliest signs of cancer, preventive measures against cancer, and the characteristics of odors emanating from the human body. What is cancer? Cancer, as people call it, refers to any malignant tumor, regardless of its location and structure. From a medical point of view, it's not quite accurate. Cancer is a malignant tumor originating from epithelial cells. But regardless of the terminology, the essence of the process remains the same. Cancer is always a rapidly progressing tumor that metastasizes. The presence of such a focus in the body leads to the disruption of the functioning of all systems, not just the organ from which the tumor originates. The entire body suffers as a result of cancer intoxication caused by the products of the breakdown of atypical cells, the appearance of metastases in the lymph nodes, which cease to perform their function, distant metastasis, when cancer cells spread to different organs. Now let's delve into what happens and how it happens. Cancer is the appearance of mutated cells. The transformation of normal cells occurs under the influence of external factors and against the background of genetic predisposition. External factors that may influence include physical factors, primarily various types of radiation, chemical agents such as tobacco smoke, asbestos, and other toxins, biological agents of oncology, carcinogens, certain types of viruses, bacteria, fungi. Predisposing factors in the development of oncology may include chronic inflammatory diseases, prolonged infectious diseases, metabolic disorders and hormonal dysfunction, harmful habits leading to the constant presence of irritating tissue toxins, smoking, alcohol and drug use, unsystematic use of medicinal drugs, various immunodeficiencies. How do mutations occur? Before delving into pathology, let's briefly touch on the norm. In a healthy body, there are constant processes of dying off old cells that have completed their function and the emergence of new, young, functional cells. The smallest structural and functional unit in any organism is the cell. The cell nucleus contains genetic information that determines the structure, functionality, and function of this element. Under the influence of adverse factors, the genetic code is disrupted. Atypical cells appear, which are cells that cannot function properly. Interestingly, such cells exist in small quantities even in completely healthy individuals. Unlike other cells, mutants don't disappear or die. They persist. And if their numbers increase, the immune system's defense against them weakens, and that's when tumors begin to grow. Atypical cells gradually displace healthy ones, and given their lack of functionality, the organ stops functioning normally. For cancer cells, the following are characteristic: tendency towards uncontrolled proliferation, low differentiation, meaning a low level of development, probability of detachment from the surface and spreading through the bloodstream throughout the body, ability to attach and invade any tissue, lack of specialization and functionality. These cells proliferate and spread, infiltrating neighboring organs, moving to nearby lymph nodes, and throughout the body. Early signs of cancer. For cancer treatment to be successful, it's desirable to detect the disease at its earliest stages. This can be challenging, but it's essential to have an approximate understanding of when screening is advisable. The presence of predisposing factors itself suggests the need for regular screening to detect possible changes in the body. Such signs include any inflammatory conditions caused by bacteria, autoimmune processes, toxins, prolonged exposure to adverse conditions, working in hazardous environments, living in areas with high levels of radiation, deficiency of essential elements, regular smoking, alcohol abuse, drug use, indiscriminate use of medications, insufficient physical activity, sedentary lifestyle, Obesity, poor diet, consumption of products containing various additives, trans fats, inadequate intake of minerals, vitamins, fiber, age. The older a person gets, the more altered cells accumulate in their body, thus increasing the likelihood of cancer formation. Early symptoms of cancer can be general for any localization and specific, depending on the affected organ. General symptoms include weight loss, a decrease in weight over a short period without special procedures and diets, unexplained fever, which can take various forms, be intermittent or constant, high or subfebrile, changes in skin color tone, the appearance of an unhealthy flush on the cheeks, slight jaundice, pallor, deterioration of overall well-being, decreased performance, almost constant weakness, enlargement of peripheral lymph nodes, loss of appetite. General symptoms also include a depressive mood, and in some cases, the appearance of a specific body odor. We'll talk more about the odor a bit later. Depending on the tumor's location, corresponding manifestations are noted. If the tumor is in the throat, hoarseness of voice, coughing. When the lung or bronchus is affected, coughing and shortness of breath. Involvement of the gastrointestinal tract may lead to heartburn, stool disturbances, and the appearance of blood during defecation. In the case of a skin process, the formation of spots and ulcers on the skin. In gynecology, uterine bleeding may occur. In urology, urinary dysfunction. When the tumor is in the brain, neurological symptoms and mental disorders occur. Bone involvement leads to pathological fractures, i.e., bone integrity disruption without trauma or impact. Pain sensations are also often noted in many cases, especially if cancer infiltrates or displaces adjacent organs or tissues. Now let's go back to the body odor. What does the human body smell like, and what aroma does cancer have? The body odor, without the use of perfumes and deodorants, is composed of smells from skin, secretions from sebaceous glands, sweat, secretions from the genital tract. The intensity and nuances of this odor are determined by age, gender. Men and women smell differently, presence of diseases, and environmental conditions. If a person is healthy, practices personal hygiene, is in optimal climatic conditions, eats well, and has no harmful habits, their body odor is not noticeable to others. Practically all human secretions are odorless. A scent, often quite unpleasant, appears with various disruptions in the body and is caused by proliferation of bacterial and fungal microflora, circulation of toxins, insufficiently active excretion of end products of biochemical metabolic reactions. In a person suffering from chronic diseases, a special shade of body odor gradually forms. If it smells like acetone, there may be problems with the kidneys or the presence of diabetes. When it smells like cats, there may be problems with the lungs, possibly tuberculosis. If it smells like vinegar, digestive disorders should be excluded. And in women, diseases of the mammary glands. When a sweet rotten smell emanates, there is a focus of purulent necrotic inflammation. A fishy smell indicates active fungal reproduction in the body. Hydrogen sulfide often smells with gastric ulcer disease. Specific odors are characteristic of hepatitis and cirrhosis of the liver, kidney failure and metabolic syndrome, obesity, alcohol intoxication. There is also an unpleasant odor associated with the presence of oncology. It particularly manifests in the late stages of cancer when the tumor decomposes. Atypical cells release specific chemical compounds, and secondary bacterial inflammation occurs. The odor of oncology is a heavy, unpleasant smell of rotting meat, dampness, mold, and fungi. What can be done to prevent cancer? Reducing the risk of cancer can be achieved by eliminating factors that provoke cell mutations. Prevention of many diseases, including cancer, involves maintaining a healthy lifestyle, consuming natural foods, and giving up harmful habits. To significantly reduce the risk of cancer, one should avoid tobacco exposure. Both passive and active smoking, as well as chewing tobacco, contribute to cell mutations and the development of cancer, affecting not only the respiratory organs, but also other organs and systems. Eat a balanced diet, and drink at least 1.5 liters of plain water daily. This helps reduce the likelihood of disruptions in the smooth flow of all metabolic processes. Nutrition should be balanced in terms of protein, fat, carbohydrates, vitamins, and minerals. Maintain optimal weight. Engage in physical activity. Participate in sports. Work more. And spend time outdoors. Develop resilience to stress. Try to react less emotionally to psychologically traumatic situations. Avoid getting upset over trivial matters. Minimize anger and irritation. And smile more. Limit exposure to sunlight. Be outdoors in sunny places only in the morning and evening hours. Avoid direct sunlight from 10 a.m. to 4 p.m. Wear light clothing for sun protection. Use special cosmetics to protect the skin from sunlight. Avoid possible infection with infectious diseases. Get vaccinated against hepatitis B, human papillomavirus, and adhere to the vaccination schedule. Try to avoid risky behaviors that may result in HIV infection, hepatitis B and C, and human papillomavirus. Do not abuse alcohol. Ethyl alcohol causes chronic intoxication, stimulates the inflammatory process, and leads to a high probability of cell mutation. Avoid unnecessary use of medications. Refrain from using drugs and stimulants. Among all the factors influencing the likelihood of cancer, nutrition occupies a special place. After all, everything beneficial and harmful a person gets from food. Food can either maintain health or have a detrimental effect on it. There are foods that contribute to the development of cancer, while others protect the body's cells from changes and the development of atypical conditions. Foods that cause cancer. Carcinogenic food. Carcinogens, compounds capable of causing disruptions in the genetic code of cells, are found in red meat, primarily meat from animals and poultry. This meat contains a high concentration of hemoglobin, which, when digested, forms nitro compounds. They can damage the mucous membrane of the gastrointestinal tract and affect cell regeneration, triggering mechanisms of abnormal cell division. Processed meat products and canned meat. Nitrites are added to them during processing. Nitrites, under the influence of gastric juice, turn into nitrosamines, which are carcinogens. Vegetables and fruits grown with frequent use of nitrogen fertilizers. Nitrogen fertilizers, in the form of nitrates, accumulate in fruits. During storage, nitrates turn into nitrites. And then, as with the consumption of red meat, in the stomach, some of the nitrites transform into the carcinogens nitrosamines. Smoked foods, where the original product is enveloped in smoke, containing benzopyrene and aromatic hydrocarbons during cooking. Salted foods, dishes prepared with excessive amounts of salt. With frequent consumption, chlorine accumulates in the body, which is a strong carcinogen. Mayonnaise, margarine, and all products containing trans fats in their preparation. Chemical substances in vegetable oils are used to obtain trans fats. As a result of such processing, the structure of the original fat changes, allowing it to influence the sequence of elements in the genetic material of cells. Peanuts. This legume is often affected by a specific type of fungus. This fungus synthesizes aflatoxin, a powerful carcinogen. Sugar, pastries, white bread, and anything containing white flour. All these products consist of fast carbohydrates, which disrupt metabolism and digestion, especially if consumed regularly and frequently. Carbonated water and packaged juices containing sweeteners. These drinks adversely affect metabolism, causing disruptions in the functioning of many organs and systems. Fried foods. The crust formed during frying contains acrylamide, a toxin that stimulates cancer development. There is also a lot of it in the oil left after cooking food in a frying pan. Reusing it is absolutely prohibited. During the next heat treatment, the amount of carcinogen increases exponentially. While foods that stimulate cancer are understood, it is worth mentioning the foods that protect against cancer. Food against cancer, helping maintain proper and consistent metabolism, thereby protecting against oncology, are the following products: leafy greens, especially those dark green in color, contain carotenoids that neutralize free radicals and effectively combat other carcinogens. All types of cabbage, but especially broccoli, cauliflower, and kale. Cabbage contains substances such as isothiocyanates, which destroy abnormal cells without harming normal cells. Garlic, truly a vegetable for all diseases. It adeptly handles any inflammatory process, atherosclerosis, and reduces the likelihood of oncology. Whole grains, cereals, and bread made from whole grain flour are extremely rich in fiber and B vitamins. This leads to timely elimination of toxins and supports active metabolism. Grapefruits contain monoterpenes. These substances bind to carcinogens and remove them from the body. Oranges and lemons contain limonene, which stimulates the synthesis of lymphocytes, blood cells that neutralize cancer cells. Green tea contains several types of biologically active substances called flavonoids. They reduce the likelihood of genetic information disruption in cells. Grapes, natural grape juice, or homemade red wine contain resveratrol, an active antioxidant that protects against mutations. Tomatoes contain lycopene, a compound that has a positive effect on cell division, ensuring the proper sequence in the carriers of genetic information located in the nuclei. Seaweed, containing beneficial acids, phytohormones, vitamins, and minerals, help halt cancer progression and reduce the likelihood of its occurrence. What to do if you suspect cancer? Proper selection of daily consumed products and an active lifestyle allow you to slow down aging and reduce the likelihood of developing cancer. However, if symptoms indicating possible cancer development appear, you should undergo examinations and see a doctor as soon as possible. The medical specialty dealing with the diagnosis and treatment of cancer is called oncology, and doctors who specialize in it are called oncologists. But before visiting an oncologist, you should see a therapist, undergo tests, and examinations. The examination plan for suspected cancer can be presented as follows: complete blood count with leukocyte formula and erythrocyte sedimentation rate determination. This analysis allows assessment of the body's condition, detection of anemia, clarification of the intensity of blood formation, and recognition of hidden inflammation. Biochemical blood test, which includes parameters determining the main biochemical reactions and the functioning of organs and systems. It is necessary to determine glucose, total protein, liver enzymes, and bilirubin, urea, creatinine, uric acid, amylase, and electrolytes. Urinalysis, allowing evaluation of kidney function. ECG to determine the capabilities of the heart muscle. MRI or CT of the abdominal organs, pelvis, and brain to detect pathology and assess the extent of the process. Endoscopic examinations, most commonly gastroscopy and colonoscopy, and less frequently bronchoscopy. They are performed to assess the condition of the mucous membrane and, if necessary, take a biopsy. Histological examination of puncture samples, biopsies, smears, and washings, allowing assessment of the cellular composition of the tumor. If cancer is detected, comprehensive treatment is conducted.